Rotationplasty, more commonly known as Van Ness or Burgrave rotation, is a type of autograft where a portion of a limb is removed, while the remaining limb below the involved portion is rotated and reattached. The procedure is used when a portion of an extremity is injured or involved with a disease, such as cancer. Typically, the ankle joint becomes the knee joint.
History of rotationplasty. Rotationplasty was first performed by Burgrave in 1927. He performed the procedure on a 12-year-old boy who suffered from tuberculosis. However, the procedure was not well known until 1950. At that time, physician Van Ness reported the results of rotationplasty procedures. He became well known for founding the procedure. Since then, many surgeons have performed modified versions of rotationplasty and have had great success.
The most common rotationplasty procedure involves amputation of the leg above the knee. The portion of the lower leg and foot are rotated to 180 degrees and reattached. The foot is positioned where the knee used to be, with the heel portion in front and the toes pointed back. The toes are the limb used for the prosthetic attachment point. Things to consider prior to receiving rotationplasty are the age of the child, the location and size of the cancer, the medical diagnosis and prognosis, and the functional outcomes. The primary reason for rotationplasty is that it enhances the person's mobility as a prosthesis user. Patients who undergo rotationplasty require intensive physical therapy to gain motion and strength in the reconstructed limb.
Although it's not clear what causes most bone cancers, doctors note bone cancer begins as an error in cell's DNA. The error tells the cell to grow and divide in an uncontrolled way. These cells go on living rather than dying at a set time. The accumulating mutated cells form a mass tumor that can invade nearby structures or spread to other areas of the body. Even though it's not clear what causes bone cancer, doctors have found certain factors associated with an increased risk. Inherited genetic syndromes, which are certain rare genetic syndromes passed through families, increasing the risk of bone cancer. Paget's disease of bone, most commonly occurring in older adults. Paget's disease of bone can increase the risk of bone cancer developing later. Radiation therapy is an exposure to large doses of radiation, such as those given during radiation therapy for cancer, increases the risk of bone cancer in the future. Osteosarcoma is a type of bone cancer that begins in the cells that form bones. Osteosarcoma most often occurs in long bones that make up arms and legs. Though it can occur in any bone, it tends to occur in children and young adults. Symptoms include localized bone pain and swelling. Treatment typically involves surgery, chemotherapy, and radiation.
Our patient, John Doe, was diagnosed on April 14, 2014. 2 months later, on June 7, 2014, the findings per the radiologist's notes were: aggressive appearing lesions involving the lateral condyle is again noted with loss of demarcation of roughly 3 centimeters of the lateral cortex at the level of the metaphysis. There is increased lobular lucency of the lateral condyle, presumably related to treatment changes. The extent of aggressive periosteal reaction appears fairly similar. There is some patchy decreased density to the central proximal tibia epiphysis, immediately beneath the tibial spine, in the location of uptake on the previous bone scan. Suggested also is mild increased disuse osteopenia with increased lucent band near the proximal tibial and fibular physis. The findings for the nuclear medicine whole body scan, per the radiologist, were intense radiopharmaceutical uptake within the distal left femur at the site of the primary bone malignancy. There is less intense activity within the left proximal tibial epiphysis. Involvement of the proximal left tibia is not demonstrated on comparison CT or MRI examinations. Activity is normal throughout the axial and the appendicular skeleton. Soft tissue and renal activity are normal.
Post-surgery images. from 9/25/2015. Findings. Post-surgical findings of tumor resection and rotation osteotomy with lateral plate and screw fixation of the proximal femoral diaphysis to the proximal to mid-tibial diaphysis are again seen. No significant change in bony alignment is identified. The orthopedic hardware is radiographically intact without evidence of loosening. There is no definite evidence of healing, no evidence of disease reoccurrence. Numerous surgical clips are again seen within the soft tissues of the left lower extremity.
Time for a prosthesis. The number of steps that need to be taken in order for a patient to receive their perfect prosthetic limb for radioplasty start with building the prosthesis requires exact measurements for height, weight, the alignment. Equally important for function and aesthetics is the measurement of the residual limb for foot extension. Desired extension is 0 degree or better. The prosthesis captures a model of residual limb by creating a mold through casting. The molded cast combines with a measurement served as a blueprint for building of housing for the residual limb. Then the prosthetist creates the prosthesis. The prosthetic foot, ankle support bars, and Velcro straps are attached to the housing. Once the product has been finished, the patient works with the prosthetist to determine the fit, comfort, and function. Communication between the patient and prosthetic maker are key to a successful prosthesis. Some of the signs and symptoms of bone cancer include bone pain, swelling and tenderness near the affected area, broken bone, fatigue, unintended weight loss.
Outcomes. The surgical procedure for rotationplasty typically takes from 6 to 10 hours to complete. After the procedure, there's close monitoring in the ICU for blood supply to foot. Hospital stay varies 5 to 7 days depending on patient. Cast is then placed on a child, which remains on for 6 to 12 weeks depending on the bone's healing process. Just a note, children on chemo take longer to heal. Patients with rotationplasty have good functional outcome and have a high quality of life. Kids can actively participate in sports with minimal limitation. Complications with rotationplasty surgery include limited blood supply, infection, nerve injuries, and failure of the bone to heal properly. There could also be fractures with the leg itself.